Good evening, everyone. So, my next topic, which I'm going to discuss with you, is on drug interactions. Means drug interactions, drug disease interactions, herbal drug interactions, all these drug food interactions. I'm going to discuss with you a brief about drug interactions with you in this video. Now, a drug interaction refers to the possibility of alteration in the intensity of pharmacological effects of a drug by a factor like co-administration of another drug, a herbal preparation, a food item, or a disease condition. Means it is the possibility how much the pharmacological effect of the drug it is altered, how by when we co-administer any other drug or when we co-administer the any food item or any herbal product we co-administer, what is the change in the pharmacological effect of the drug, that is the or any disease condition, what is the effect, that is the drug interaction. The net result, it can be enhanced, but it can enhance the pharmacological action also, and it can diminish the effect also, and there can be also the appearance of the new effect. New effect can be appeared, it can be enhanced or it can be diminished. Now, drug food interactions. Some food items may exhibit interactions with certain drugs, like milk. It forms the chelating complex. The calcium ions in the milk, they form the unabsorbable chelating complexes with iron tetracyclines, so that absorption of these drugs from intestine is decreased. Means iron and tetracycline absorption will decrease in the intestine, and the tyramine, which is the indirectly acting sympathomimetic agent, it is it contained in the cheese, chocolate, etc. That will interact with MAO inhibitors. The tyramine, it interacts with MAO inhibitors. Means it will when it is co-administered with MAO inhibitors, which the MAO monoamine oxidase, it is responsible for the metabolism of adrenaline, noradrenaline in the body. And when this MAO is inhibited, there is increased levels of adrenaline will lead to hypertensive crisis. So these are indirectly sympathomimetic agents. These are acting as the indirectly sympathomimetic agents, tyramine. And there will be hypertensive crisis in the body when this products like cheese, yogurt, chocolate, milk products, they are given with the MAO inhibitors. Tyramine is given with the MAO inhibitors. Now, herb injections. This herbal preparations may interact with allopathic drugs. Means the allopathic drugs and the herbal preparations, they may interact, so that the prescriber need to be careful while taking the drug history. Means we have to be very careful, the prescriber, that whether you were taking this any herbal drug with it, with the allopathic drug or not. Like grape juice, fruit interacts with statins, leading to increased levels and toxicity. With the grape juice fruit, they will increase the level of the statins, and toxicity can occur with the statins. Of the statins can occur. And bitter gourd, which is also known as the Karela in vernacular, it causes hypoglycemic effect and may potentiate the action of oral hypoglycemic agents. Means it causes hypoglycemia in this Karela, which is bitter gourd, and it can potentiate the action of oral hypoglycemic agents like biguanide, sulfonylurea, thiazolidine miglitinides, all those. Drug interactions. Drugs may interact with other drugs given concomitantly, and they may interact with other drugs when they're given in combination with these drugs. Prescribers should be careful to avoid polypharmacy. Polypharmacy is when in the elderly patients there's a comorbid conditions are there like hypertension, diabetes, cancer, rheumatoid arthritis, osteoarthritis, any cardiovascular disease like coronary artery disease. All these diseases are present in combination in the patients, and so around about 5 to 6 medicines the patient is taking, so that can lead to polypharmacy, and that can lead to various drug interactions. Drug which have to be co-administered should not exhibit undesirable interactions. With drugs, They should not exhibit the undesirable contractions, and the drugs which have the desirable interactions, they are available as the fixed two drug combinations, which they enhance the effect of the drugs of the parent drug which was given, and the other drug it enhances the effect. So that can lead to fixed drug combinations, and when it is having the undesirable effect, so that is stopped. That combination has to be stopped. Like rifampicin, which was the enzyme inducer, it was given to the female who was on oral contraceptives. It led to contraceptive failure due to inducing of the metabolism. In rifampicin, which is the anti-tubercular drug, it induces the metabolism of the oral contraceptive, so there will be contraceptive failure in the females. And levodopa, which is the dopamine precursor, it was given along with the carbidopa, which is peripheral decarboxylase inhibitor. Means it inhibits the dopa decarboxylase in the periphery, and it will lead to more of the levodopa or the dopamine to enter in the brain, and more of it will be entering in the brain, and that will lead to potentiation or increase in action of the uh, levodopa in the brain, and which will have the anti-Parkinsonian action. Other interactions with physiological chemicals, these are not important clinically, as these are already accounted for, while making the drug formulations. With these are we take into account when we make the drug formulations. These are not so important clinically, like pH of the stomach, like acidic drugs, they will be more absorbed in the acidic medium of the stomach, and in the basic medium of the stomach of the intestine, small intestine, the basic drugs will be absorbed. Enzymes in the gut can lead to metabolism or the breakdown of certain drugs, can be there. Bile acids, plasma proteins like alpha-1 acids, glycoprotein, and albumin, they are responsible for binding to various acidic and basic drugs that will lead to free bound concentration less or unbound concentration less. Like alpha-1 acid glycoprotein combines with the acidic drugs, sorry, combines with the basic drugs. So it will lead to decrease in the levels of basic drugs in the body, that will lead to decreased effect. And the albumin binds to acidic drugs, so that can lead to less acidic drugs available in the body as the free unbound drug. Drug disease interactions of certain diseases may alter the physiological status in a way to affect the actions of some drugs. Like in the hepatic disease, if the patient is suffering from some hepatic disease, it can lead to high plasma levels of many drugs. Why? Because metabolism will be affected, liver metabolism will be affected, it will be reduced in the hepatic disease, so that can lead to accumulation of the drugs in the body, higher plasma levels of the drug in the body, like terpinadine, which is the antihistaminic drug, cisapride, which is prokinetic, and phenytoin, which is anti-epileptic. That levels increase in the body. And in the renal disease also, the renal excretion decreases. It may lead to toxicity of the drugs because it will be excreted unchanged by the kidneys, like digoxin and gentamicin. The levels will increase in the body because renal excretion, tubular secretion decreases, GFR decreases. Drug-drug interactions, pharmaceutical interactions. These are physicochemical interactions which occur outside the body. This is prior to administration. Like it occurs outside the body prior to administration. Like amphotericin, it gets precipitated in the presence of the normal saline. When amphotericin, which is the antifungal drug, is mixed with normal saline, it gets precipitated. So its action is stopped. In the same way, penicillin and gentamicin get precipitated if given in the same syringe. Gentamicin, which is a aminoglycoside, and penicillin, which is beta-lactam antibiotic, these can be precipitated if given in the same syringe. Now, interactions inside the body. Now, pharmacokinetic interactions. Drugs may interact at any point during absorption, distribution, metabolism, or excretion. These drugs can interact at any point. They can interact at any point during absorption, metabolism, distribution, and excretion. Result may be that either there is increase in concentration of the drug or there is decrease in concentration of the drug at the site of action. Now, at absorption level, first of all, These could be either inhibition or facilitation of absorption of a drug by another drug or chemical or food. Means either there is inhibition or there is increase in the absorption of the drug is there by another drug. Like physicochemical reactions prior to absorption, any physicochemical reaction prior to absorption is responsible. Any alteration of the gut motility, alteration of the gut flora by tetracyclines are the suggested mechanisms of such injections. Like antacids, they reduce the absorption. Antacids, they reduce the absorption of the drugs like they form the chelating complexes, these antacids, with the tetracyclines, fluoroquinolones, and non-steroidal anti-inflammatory drugs, and they will reduce the absorption of these drugs, antacids. And vitamin C, it facilitates the absorption of the iron salts. It will reduce the ferric salts into the ferrous soil, ferrous salts, and this vitamin C it will lead to absorption of the ferrous salts from the stomach in the GIT. So vitamin C increases absorption of the iron salts. At distribution level, there are various plasma proteins present. Many drugs are extremely extensively bound to plasma proteins. Different drugs may compete for the same site of the plasma proteins, and displacement of one drug from its binding site by the another may alter its plasma concentration and hence enhance its action. With certain drugs, they will displace the drugs from the plasma proteins. So the drug which will be displaced by one drug which is displaced by the another drug, it will lead to increase in levels of the drug which has been displaced. So however, effect of such interactions is usually transient, that is slow, and rarely of clinical significance, like sulfonamides and indomethacin, which is non-steroidal anti-inflammatory drug. It will displace warfarin from binding site of the plasma protein, and it may lead to bleeding tendencies. Means warfarin will be displaced, so levels of warfarin will increase in the body, and that can lead to bleeding, which is the anticoagulant drug. It can lead to bleeding tendencies. Warfarin levels increase can lead to bleeding tendencies. At metabolism is they may inhibit or induce the metabolism of another drug and leading to increase or decrease in plasma concentration. If they will inhibit the metabolism, that can lead to increase in the plasma concentration, and if it induce or they induce the metabolism, that can lead to decrease in the plasma concentration. Like erythromycin, which is the enzyme inhibitor, it inhibits the metabolism of terfenadine. So terfenadine, it will lead to QT prolongation and torsades, pointes, and ventricular arrhythmias, tachyarrhythmias in the body when there is a inhibition of the terfenadine by the erythromycin, leading to increase in levels of the terfenadine, and there is toxicity. And rifampicin can reduce the metabolism of all contraceptives. It will reduce the metabolism, so levels of all contraceptives will decrease in the body, leading to contraceptive failure. Now, at excretory level, a drug may inhibit the renal excretion of another drug, thus leading to elevated plasma levels. Means one drug can inhibit the renal excretion of another drug. And such interactions are important for those drugs which are mainly excreted unchanged by the kidneys. Like propane acid, it inhibits the excretion of penicillins, leading to elevated plasma levels and prolongation of the elimination half-life. Now, propane acid is the drug which inhibits the tubular secretion of the penicillin. The tubular secretion of penicillin will not take place, so levels of penicillin in the body will be elevated, and the half-life of the penicillin will be more. So levels will increase in the body of penicillin because tubular secretion or the excretion is inhibited by the propane acid. Propane acid is the anti-gout drug, uric acid synthase inhibitor. The pharmacodynamic interactions. Drugs may interact at a common receptor site or at different sites to have antagonistic or the synergistic effects. These drugs may act at the receptor or any other at the common receptor site or different sites, and they can lead to antagonism or synergism. Some drugs may form useful combinations as these may complement one another's beneficial effects, or one drug may inhibit adverse effects shown by the other. How they have the useful combination is they can increase the or they can complement the beneficial effect of one drug, and the two drugs they can increase or they can complement the beneficial effects. or other drug, one drug can reduce the adverse effects of the drug which is shown by the other drug. It can reduce the adverse effects or it can enhance the beneficial effects, the two combinations. Like sulfonamide and trimethoprim. Now, this is sulfonamide is the polycase synthase inhibitor, and trimethoprim is the dihydrofolate reductase inhibitor. So the PABA and the glutamate, it does not get converted to the dihydrofolate acid by inhibiting the enzyme polycase synthase inhibitor, and the dihydrofolate reductase inhibitor is the trimethoprim. So tetrahydrofolate acid is not produced. So DNA synthesis is broken down. So that can lead to inhibit the bacterial folate metabolism, leading to sequential blockade. There is sequential blockade by the sulfonamides and like sulfamethoxazole and trimethoprim. Nitrates and beta blockers as anti-anginal drugs. When beta blockers counter the reflex tachycardia caused by the nitrates as well as their own anti-anginal action, as well as have their own anti-anginal interaction. With nitrates, they cause vasodilatation basically, and they decrease the preload and they decrease the afterload. So there would be vasodilatation leading to reflex tachycardia by the nitrates. And beta blockers, they depress the heart. They act on the beta 1 receptors, they block the beta 1 receptors and they depress the heart. So they lead to bradycardia. So reflex tachycardia is counteracted by the bradycardia of the beta blockers, and plus they also have their own anti-anginal effect, beta blockers. So these can be used in combination, nitrates and beta blockers. Now drug interactions could be beneficial, like when the interactions prove to be clinically beneficial, and these are given in combinations like levodopa, which is anti-Parkinsonian drugs, is given with the combination with carbidopa, which is peripheral dopa decarboxylase inhibitor. So it will lead to increase in levels of the dopamine in the body. And trimethoprim and sulfonamides, sulfamethoxazole and trimethoprim, which is the polycase synthase inhibitor, sulfamethoxazole and dihydrofolate reductase inhibitor is the trimethoprim. So DNA synthesis doesn't take place. So that can lead to polycase synthesis doesn't take place, that can lead to killing of the drug. This is these both drugs, they are bacteriostatic in nature, but in combination, they becomes the bactericidal. Harmful or undesirable interactions may either lead to therapeutic failure if it is inducing, or it can lead to the toxicity if there is a inhibiting action. Like rifampicin is the enzyme inducer. It will cause the contraceptive failure in the oral contraceptives, and sulfonamides, they displace the warfarin from the protein binding site, leading to increase in level of warfarin, leading to bleeding tendencies. So this is how we can say that this is the undesirable interaction and these are the desirable interactions. Thank you. That's all for my lecture on drug interactions. I hope you understood. Thank you. Kindly subscribe to my YouTube channel. If this lecture is helpful, I will be very thankful to you. Happy learning. Be blessed, be safe, be healthy, be happy. Thank you. Happy learning.